Many of you are suffering with tinnitus, eustachian tube dysfunction, and many other health-related problems. So today I'm going to answer some real-life questions, some Q&A session here, and hope that this brings some relief to you and some answers to some of your questions. Give me a minute while I go back to my office, sit down at my desk, and pull up some of your questions. Alright, so let's get logged in here and take a look at this first question. So let's take a look here. From an anonymous member. Hello everyone, I have suffered from this thing for 3 years now. For me, it started during COVID. I had a really bad flu with runny nose, and at the end of my recovery, it's when it all started. First, it was my right ear, which got blocked really bad and I couldn't hear a thing. I went to an ENT and she told me it was from the eustachian tube being inflamed from the flu. She suggested me to do the Valsalva maneuver, and that's what I did. Doing the Valsalva maneuver blocked my other ear. Because you're not supposed to do the Valsalva when you're sick, and no one told me this. At first it was really bad for me. I couldn't hear a thing, a lot of pressure, I needed to pop my ears all the time. I started to feel isolated from everything. If it was too silent or if it was too loud, everything was bad. I did a scan of my head at the time. I visited like 5 different ENT, a neurologist, a naturopath, a homeopathic doctor, physiotherapist, dentist, and maxillofacial. So in conclusion, I tried everything and everyone said I was okay. To that anonymous member, my heart goes out to you. I've been in your shoes before. I have been through all of that. I can sense the frustration that you're going through, and I also want to note the resilience that you have to get through it. Now, I do want to address a couple of things. You mentioned the Valsalva maneuver causing more problems. Now, I'm very surprised that the provider even recommended doing the Valsalva maneuver. It's a situational exercise that really requires some experience to be able to do that, but not only just experience, it does need to be a situational thing where if you're in a position to do it, it can't be done just randomly. It has to be evaluated. So it's kind of a really touchy subject as far as that maneuver goes. And I'm even surprised that the provider recommend doing that, because it could cause more issues. And that definitely seems to be what happened to you here. Now, as far as what you have been going through, as far as the clogged ears and the pressure that you feel, you do want to make sure, and my recommendation is to stay on top of doing eustachian tube exercises. I have great videos on my channel that you can dive into that help with different eustachian tube exercises, as well as a recent video I've done that you can do definitely some ear pulling. That's basically pulling on the ears lightly and gently to get that eustachian tube to get back into a functioning perspective there. So we want to be sure that we do these things with caution. Now, I also recommend doing some steam inhalation. Now, inhale steam from a bowl of hot water or a steam humidifier. This is going to help loosen up a lot of things there. That's going to help reduce the inflammation that you stated. This is the most natural way to reduce the inflammation while also providing some anxiety relief. Believe it or not, it's going to help with your breathing. So, reading your story, your message really tells me that there's a lot of mental decline there. And as well as you should feel that way, you've probably seen several doctors, and you are definitely getting to the point where you are in this roller coaster, this never-ending ride that's not fun, and it's just causing more leeriness to do things. And so when you get into this spiral effect, you get into this motion, it's hard to break out of it because everything seems like it ends not in a good, pleasant manner. So like when you do things, you feel symptoms, you feel sensations, and then you relate the things that you did with those symptoms and sensations, so it just kind of spirals out of focus, and you just don't feel right. So my recommendation is do your absolute best not to halt the things that you've been doing, and eventually you'll turn that tide and you'll start to relate good things with what you feel versus the bad things. All right, let's pull up the next question here from an anonymous member. Hi, new to this group. Can anyone relate? Constant pressure in ears, itching sensations, pain, blocked nose, and vertigo with headaches. Have been back to GP, have said it's a eustachian tube dysfunction. General practitioner, by the way. Had antibiotics, nasal sprays, and nothing has worked. Have now been referred for ENT, but cannot help but think the worst. Yeah, I do want to address this. Now, keep in mind this is for informational purposes only. Nothing I say is to diagnose, treat, or put you on any medical plan, but I do want to tell you this. Now, as far as the constant pressure in the ears goes, this could be a number of things. Now, You will probably hear that you have allergies. Sometimes I tend to think that that's not always the case, but nonetheless, it's good to get tested. As far as pressure, though, I want to advise that could be simply just having poor posture. It could be having a stiff neck. It could be jaw stiffness. It could be leading to just overall poor posture in general. If you're not moving the body in the correct manner, the body starts to fire and wire in a way that's not going to be pleasant. So you got to be sure to move the body. You got to be stretching the neck constantly. Every single day you got to stretch the neck. You got to be sure to do that, because that can lead to pressure. It's not always something inside the ear per se, but it could be the outside things surrounding the ear. And by things, muscles, nerves, tissues, we have a lot of surrounding things. So the muscles can tighten up and you can feel that pressure. Now, my recommendation, again, nasal sprays have been shown to give you more harm than good in most cases when it comes to eustachian tube dysfunction. Now, is to say that nasal sprays are all bad? No. But in this sense, nasal sprays aren't going to help you if there's something structural going on with the jaw, the neck, just aforementioned problems with it being stiff and not being well worked out. So you got to be sure to concentrate on those things. So if you're not exercising regularly, put that into your regimen. Even if you don't feel that great, do light exercises. This is going to help get the blood flowing. It's going to help loosen the muscles. This is actually going to help with just your overall mood, which is going to help you heal, because if your mood is better, your body's going to perform better and respond better. Now, obviously, I won't get into this a lot here, but antibiotics, obviously you were recommended this by a doctor, but I do want to let you know that antibiotics are used to treat infections, and it definitely seems like you were detected to have an infection, and so sometimes it could be the antibiotics trying to work that out of your system. And so if you have an infection, you're going to notice a lot of what you feel, and you sometimes have to run the course. You have to keep these things, but being natural, staying closer to the natural things, doing the basic things, improving areas that you should be doing already no matter what, even if you have ETD, like exercising, drinking adequate water. If you're dehydrated, you're going to feel all of what you feel here. So just going back to the basics, increasing your vitamins, increasing your vegetables, and doing those simple things to get yourself back in check. So I hope that was very helpful for you. All right, so let's move on to the next question. This one is from an anonymous member. Question reads, so this will sound a little odd and I appreciate quite unscientific, but hear me out. Has anyone noticed that after drinking a bigger than usual quantity of alcohol that their hearing actually improves the next day, especially anyone who has had balloon dilation procedure? I've gotten this question before. Now, it may seem counterintuitive. Some people have reported temporary improvements in hearing and ear problems after consuming alcohol. But, however, it's essential that we don't go that route. But let me explain to why it does seem better and why the hearing is improved. And there's a couple of things. So there's something called ethanol. Ethanol is what's found in alcohol, and that can cause blood vessels to dilate, which definitely could help improve the blood flow in the ears, increase blood flow. It could potentially reduce inflammation. But here's the thing. Obviously, with alcohol, you're going to see a spike in bad things happening to you. Now, this can raise your blood pressure. This can cause your body to be dehydrated. This can cause a dependence. This can actually trigger anxiety. This can trigger stress. All these things, it can put a huge weight on your kidneys. So let's not do that. So like many things in life, just because it feels good in the moment doesn't mean it's going to help you in the long run. We got to be very cautious with things like that. So you may get these temporary relaxational situations that seem just right for you. It may be relaxing your muscles. When you consume alcohol, you may feel this anxiety drop, but in the long run, it's going to come back and find you. And we got to be very cautious with these things. With smoking, with alcohol, with excessive caffeine consumption, these things only put more pressure on our ears, more pressure on our body. And remember, to win this war of eustachian tube dysfunction, it's a slow jog pace, not a sprint. So you want to do things for the long run so you can reap the necessary long-term benefits. Alrighty, my people, I hope this video was very helpful for you. If it was, please take time to subscribe to the channel. I try to bring content as often as possible. But in the meantime, I'm going to step out of the Jaye Wellness Studio and leave you in good hands with this video. Like anything else, folks, we're here to simply go back to the basics. Take care, everybody, and I'll catch you on the next video.